Testing thyroid hormones. This is going to go through all the comprehensive testing that you're going to need to figure out where your thyroid function is and how to improve it. The main important tests. These are the tests that everybody should get. TSH, thyroid stimulating hormone. This tells us that your pituitary gland has recognized that there is not enough circulating thyroid hormone. A TSH that's high means there's not enough hormone. A TSH that's low means that there's too much thyroid hormone. So TSH is basically your body's signal to make more thyroid hormone. Free T3 and free T4. These actually measure the amount of active thyroid hormones we have in our bloodstream. TPO antibodies and TG antibodies are the main antibodies in Hashimoto's thyroiditis. These antibodies tell us that the thyroid gland has been recognized by the immune system and is under attack. Now, these antibodies are going to be higher when the attack on the thyroid gland is more aggressive and lower when the attack on the thyroid gland is not as aggressive. And so our goal for monitoring these antibodies is to figure out what our baseline is, how aggressive is the attack on the thyroid gland, and then we're also going to try to work on reducing the antibodies. And reducing the antibodies helps to dampen the autoimmunity. So basically, the thyroid antibodies are going to be used as a marker to track your improvement. Now, there's a whole host of other markers, and if you've been following other thyroid experts, people will say that thyroid antibodies are not the perfect marker, and I would completely agree with that, but they can definitely show us some important trends and things that are happening within our bodies, and we want to see them reduce as we make interventions. They can also tell us if an intervention is working, right? TSH, free T3, and free T4 will help us understand if you need a dosage adjustment of medications or if you need to switch your medications. An ultrasound of the thyroid gland is also something that I recommend doing at least once in your lifetime if you have Hashimoto's or thyroid disease, and then following up on an annual basis if you have thyroid nodules. One thing I should mention is that going through the Hashimoto's self-management program will likely result in shrinking and potentially disappearance of nodules as well. This is something that's very exciting and actually quite new to me. I didn't realize that all these interventions can actually shrink nodules until I started having people reporting to me that while working on their Hashimoto's, they also saw their nodules shrinking and going away. So this is a little side bonus that I'm really excited about. These labs can be ordered on your own, or you can get them from your practitioner. Good news is that all of these labs are going to be covered on insurance if you have insurance. So, like I said, when looking to optimize your thyroid medications, we're going to want to see a TSH, free T3, and free T4. Some doctors will also recommend testing for reverse T3. I'm not a stickler for it because basically, if it's elevated, it just tells us that we have a lot of adrenal stress, and it doesn't give us a lot of useful information. I recommend testing these labs every 4 to 6 weeks unless you're symptom-free. So as you're trying to get on the right dosage of medication, we want to test every 4 to 6 weeks. If you're symptom-free, if you're stabilized on your thyroid medications, every 3 months to 1 year may be appropriate for testing. When to test? Unfortunately, I've had quite a few of my clients test their thyroid hormones at the wrong time of day, and they ended up being either overdosed or underdosed on thyroid medications because their doctors didn't interpret their results properly. This is especially important if you're taking medications that contain T3. You want to test your thyroid hormones first thing in the morning before your dose of medication. If you take T3, this can actually skew your results. So if you were to take your medication and take the thyroid test, it would show that you had an overactive thyroid when your thyroid function was stable and normal. One thing I recommend is taking your medication with you to the lab appointment and take it immediately after the test. Going into greater detail of what each test means. The TSH test is the first responder. So this is something that's going to be altered whenever we have not enough circulating thyroid hormones in the body. It's not a thyroid hormone. It's actually a pituitary hormone that responds to low levels of circulating thyroid hormones. Low means overactive thyroid and high means underactive thyroid, and that we need more external thyroid hormones. In advanced cases of Hashimoto's and primary hypothyroidism, this lab test will be elevated. One thing to notice is that there's also, in some cases, people may have different types of hypothyroidism that may be caused by an imbalanced communication pathway between the pituitary and between the thyroid gland. And so in the case of pituitary suppression, a person will have a normal TSH, but they'll have low levels of thyroid hormones. And this is exactly why it's important to not just test TSH, but also to test the thyroid hormones. As far as thyroid hormones, I like to test for active thyroid hormones. This lets us know how much hormone we have that's available for binding with our thyroid hormone receptors in our cells. Free T4, so T4, you can see here is thyroxine. If you recognize the name, you'll know that it is L-thyroxine or levothyroxine. And this is known as a prohormone or a prodrug. So T4 is not as active. It has some activity, but it's not as active as free T3. So free T3, which you'll see beneath here, is an active thyroid hormone. So it's more physiologically active than T4, and it acts as the accelerator. So what it does is it helps us grow beautiful hair, it helps us manage our metabolism, and it also helps us have more energy. Now, the challenge with people who take thyroid medications is that oftentimes they'll be given a T4 medication. Within the body, under perfect circumstances, T4 should get converted into T3. And we should be able to make as much T3 as we need from the T4. However, new research and my years and years of clinical experience with patients is showing that this doesn't always happen perfectly in the body. And many people will go on taking thyroid hormone levothyroxine and they do not feel their best and they still continue to have thyroid symptoms. Reverse T3. So I talked a little bit about this test. And I don't think it's always necessary. It can be helpful to get. Low levels of it may mean that you have not enough iodine on board, and high levels of it mean that you have too much stress. Now, reverse T3, what it does is it actually binds thyroid hormone receptors, but instead of turning them on or activating them, it actually just blocks them and turns them off, preventing the good T3, the active T3, from activating them. And so it acts as the brake. If T3 was an accelerator, reverse T3 would be the brake. There are different ranges. Depending on the lab you go to, you may get different numbers. And a lot of times, unfortunately, the lab results are going to be overly lax. And researchers have shown that when scientists first determined the reference range for thyroid hormones, they had people within the pool of blood that was supposed to be normal who actually were hypothyroid. And so this reference range was huge, where a TSH of up to 10 was considered normal. Now, I'll tell you, when my TSH was at 4.5, I felt like a sloth. Most people feel their best with a TSH somewhere between 0.5 and 2. I would say that women of childbearing age should have a TSH somewhere around 1. For free T3 and free T4, there's going to be different reference ranges. So the reference ranges aren't necessarily going to be universal. And so what we want to do is we want to aim for the top half of the reference range. Reverse T3, we're going to look for elevations, and these are often going to be adrenals, and then low levels could signal nutrient deficiencies, mostly specifically to iodine. And just from a clinical perspective, this is rare So functional ranges, here are some numbers for you of TSH, T4, total T3, free T4, free T3, as well as reverse T3. So I've provided some units here, so you want to make sure that you pay attention to the specific units that I've provided when looking at your own labs before you freak out and say, wait a minute, why is my number so much higher or so much lower? So this is for your reference.